all, I would like to congratulate you for taking up this issue, which is very relevant today. Instead of being disease-centric, everything should become patient-centric and health-centric. This is an issue which has been raised at international platform umpteen number of times. Way back when I was in the government of India, there was a WHO initiative of having patient safety infrastructure available in all the healthcare places. And government of India took certain type of initiative at that time so that patients, when they are going to the hospital, they don't fall prey to the various gaps in the system and ultimately succumb to it. There were committees which were constituted in the hospitals in at least 6-7 states, and these committees were having a very good civil society participation, a participation from the journalist and a participation from the patient who has been caused some harm, and they used to meet every month and try to deliberate what was the cause of some mishap and what can be done in the future. So I put it on record that this is a very important initiative and it will have a long way to go, and it gels with the World Health Organization initiative also. And tomorrow is the World Health Day, and will be definitely associated as a new initiative of India for having a patient-centric healthcare. Having said that, the topic which has been given to me by Rajendra is about the problem the patient faces when he is going to the health care system and the solution for it. Whether we like it or not like it, but at present, the primary health care is public dominated, the secondary and tertiary health care is private. And at both places, you have got different type of problems when you try to reach to the health facility. These problems are listed in umpteen number of reports which are available in the Public Health Journal. Some of them says that the system is weak. It means you are not able to have enough infrastructure, you are not able to have enough human support, you are not having 3 Ds and 1 Q, it means drug, devices, diagnostic and quality services. You are not having governance structures, you are not having a good funding. They are being said over there. There are other type of voices which are coming from the side of the patient. These voices say we have got a sub-center or a primary health center which is 10 kilometers away from our place, so access is the problem. The second thing they say that when we go to the hospital, we find that the doctor is there, but the drugs are not there. And if drugs are there, they are prescribed for 3 days. I get only 3 days drug. And if some diagnostic tests are advised, few of them are available, rest of them I have to go to the other places. So these are the patient perceptions. So all these perceptions are actually pointing towards the gap which we need to address by an approach which is known as whole of the government approach and whole of the community. So you try to gel the aspiration of the community, and in community the aspiration of the end user is the patient, and try to make convergence of all the government initiatives so that in the access to the services, everything is taken care of. On the other hand, if you go to the private healthcare system which is dominant in the public, in the secondary and tertiary healthcare, what you find that they are having fine hospitals, world-class hospital. All the good type of specialists are there. If they are corporate-based hospital, if they are single specialty hospital, almost same. But they are only confined to the metropolitan cities and tier 1 cities. Tier 2 is a mixture and tier 3 is absence. By chance, if some private provider is trying to put money over there, he will be there. Everything is driven by only one thing, the payer system. The payer system is either out of pocket or the payer system is from the insurance sector. Public insurance sector provides only care for hospitalized patient, and that too through the empaneled hospital, and that too for the listed conditions. Good thing it has started 2017-18, but it is a good thing, but it is not a complete solution. The out-of-pocket expenses at present might have been little bit reduced, but saying that 60 to 70% is out-of-pocket expenses, and there is a annual some percentage of the population who is going to the health facility is converted from APL to BPL, is still not reversed. So once we are trying to make a whole of the government and whole of the community approach, then we have to look at the insurance system, the easy access to the insurance system, the type of having a type of problemless, cashless type of access to the healthcare, and moreover, we have to have a robust technology-driven type of system which can make the private provider comfortable with the payer system, comfortable that their money invested and the business investment will be properly taken care of, and an industry-friendly environment by which the industry will find that the drugs which are being provided, the diagnostic tests which are being provided and which are essential over there are fully taken care of without any type of government hiccup. Artificial intelligence, technology, digital health are all coming up, and they are going to provide a lot of solutions in future to this type of gaps.